A boy or a girl? The description of a boy on ultrasound is the dumb sign or the turtle sign. Why the dumb sign? Because the scrotum here, as can be seen on this 3D, appears like a dome, and the phallus appears like the cornice of the dome. So that is why it is called the dumb sign. But let's describe it as a turtle sign. Again, here is a flip over 3D image. This is the scrotum. This is the shell or turtle. This is the head of the turtle, and this is the phallus. So that is why it's described as the turtle sign. So these are the two common descriptions for a male fetus using prenatal ultrasound. For a girl fetus, there's what is described as the three-line sign. As you can see here, 1, 2, 3 hypoechoic lines representing labial lines. This is a picture of a lip, but this is a 3D image of a female fetus. So here you can see labia majora, the space in between. So this appearance is like a lip. So that's why it is also called lip sign. This is a 2D image. You can also see the lip sign suggesting a female fetus. So let's look at these images. These are 18 weeks. So is this a boy or a girl? What you are seeing here is consistent with a dumb sign, a total sign, the lip sign, or the three lines sign. So here, look at these still images, bladder. You can see here something looking like three parallel line sign, but not that there is no opening here. So this is more like a closed circuit. Again here, you can see what looks like three line sign. The same thing here, here, but somewhere here you can see the three line sign. And as the baby moves, you can see something projecting beyond the three line sign here. Commonly, the umbilical cord hovers around the perineum. So at times it's important to be sure that what is projecting is not the umbilical cord. And how do you do that? You apply color. So you see that these the internal iliac vessels surrounding the bladder. So using that you have two umbilical arteries, but this area projecting has been taken up color. So this suggests that this is a boy, not a girl. Despite the part that you've seen, what looks like three parallel lines, but not that these three lines appear like a circle. It's not open, so it's more of a closed circuit. So let's look at the video of this case. As you can see, copious amount of amniotic fluid. This is the bladder, and of course, this is where to check for the genitalia. So here you can see what is looking like a three-line sign. This insertion of the cord in the anterior abdominal wall. So now taking a bearing from the chest, upper abdomen, lower abdomen, then you get to the bladder here. You can see the femur here. Then look at what is in between, appearing like three-line sign. But again, note that it's a closed circuit. As the baby moves, you can see something projecting here. You see that? And look at it here. What you've seen here is like a dome. Look at it, a dome and a cornice. So this is actually a boy. So if you are in a hurry and you only interpret it based on the three-line sign, you assign the wrong gender. But here, the fetus is actually communicating with me because he's telling me, okay, if you're not sure, wait, I will show you my true gender. And fetal movement is key in determining fetal gender. So you can see that maybe he's trying to show me his true gender. You see that? He said, look at the dome here. Look at the cornice here. So are you still in doubt? Really not. So don't be in a hurry to assign gender, especially based on the three parallel hyperechoic line, because the scrotum can also give you that appearance. So again, the same case, applying Doppler. You can see vessels around the bladder. You can see this three-line sign, but you can see it's closed. It's not open. So this is like to be the scrotum. You see that? And the phallus projecting. So the dome sign. And here there's no taking color. So you're sure this is not umbilical cord. So these are 29 weeks. Look at this round structure. You can see echogenic line, echogenic line, echogenic line, but it's round. So this suggests that this is the scrotum. But the problem here is that you can see a projection here and another projection here. This was when the fetus was alive. This image was taken after the fetus suffered intrauterine fetal death. So here is the umbilical cord. This is the scrotum. But look at this, what appears like a bifid penis, because you can see one here and the other here. But what helped me confirm that this is not bifid is the 3D. And after delivery, you can see the reason why we had this artifact. Look at the edema around the phallus. So let's look at this image of our abdomen as a stomach. Going down, you see the coronal view. So look at it, appear like three-line sign. But shortly after, you see the dome sign. You see that? So the three-line sign times can be confusing, especially when it's in a hurry. But look at this image. 1, 2, 3. These typical hyperechoic parallel lines. But here, let's compare this and this. You can see this is open, but here, let's hold on for a while and get that particular area. Okay, here, of course, you can see the dome sign here. Look at it here, the three-line sign. But you can see here, where this is closed, this is open. So this is a closed circuit, but this is an open circuit. So that's one way of differentiating between the scrotum and the labia when there's confusion regarding the three hyperechogenic parallel lines. So a few tips and tricks. Avoid making horrid gender assignments. There is no agency in assigning gender. And who says you must conclude for a first scan? If there's any doubt, you call the patient. But you can obtain multiple views of the genitalia. If there is a doubt as to whether what you are seeing is a phallus or a cord, apply Doppler. We've seen examples about the three hyperechoic parallel lines. Does not always reflect the female fetus. The scrotum can also give that appearance. Like here, look at 1, 2, 3. But again, you are seeing some hyperechoic parallel lines too. So the lines mustn't always be 3. At times you can have 4 hyperechoic parallel lines. But look at these lines and look at this area. It's opened. If it were the scrotum, this area will be what? Closed. So while the scrotum is a closed circuit, the labia is an open circuit. Gender can be determined in about 90 to 95% of cases after 16 weeks. In fact, one paper said in 100% of cases after 16 weeks. But before 16 weeks, be careful. And you have to be more careful if you are assigning gender in the first trimester. Of course, in late pregnancy, some difficulties may be encountered because the thighs or the hips may be abducted, and the limbs may obscure the external genitalia. When we have facilities for 3D, you can resolve virtually all cases. One trick is to move the transducer away from the body if the gender is not seen in between the thigh. Extremely helpful to move the transducer away from the body if the gender is not seen in between the thigh. So let's look at these two images. This is the boy, this is the girl. So here I'm trying to emphasize the three parallel hyperechoic lines. While here in the boy is a closed circuit, here it is an open circuit. So here, look at the scrotum here, look at hyperechoic line here, the refer here, and the hyperechoic line here. So you can see these are three lines. So of course you can see the phallus here. So this is the shell of a turtle. This is the head and neck of a turtle sign. Or this is the dome and the cornice. And here I applied color to show you that this is how to differentiate between phallus and the umbilical cord. You have challenges. So you can see here the phallus is closely related to the umbilical cord. So here, look at the three parallel hyperechoic line of a female. You see that? But while this is open, this is closed. Yes, you can have three parallel hyperechoic line, but the scrotum is usually a closed structure, closed circuit, while the labia is open. So I coin this as a closed circuit and this as open circuit. So again, here you can see the lip sign, the clue sign. In this case, both of them are in agreement. In agreement about what? In agreement about amniotic fluid dynamics. In agreement about amniotic fluid dynamics. Thank you very much for listening.